Hi, Dr. Andrea. How's it going? We're live, so this is going to be great. I would love for you to put stuff in the chat. And today we're talking about how conventional medicine has failed you. Traditional medicine, conventional medicine, kind of traditional in the United States. So first of all, it's not you that's broken, it's the system. And that's really important. That is something I say and have to say to people who come into my practice a lot of times. I want you to know that, and we're going to talk about how it's been, you know, how it's been creating something that is making people sicker. And so, if you're feeling that way, that might also be what's happening. I want you to feel seen, validated. I want you to feel empowered. I want you to know practical steps, and that's a lot of this podcast for feel better, feel great. So, when we think about your health and with your health goals, it's really important to think about the fact that you have control over your health, right? You have control over your health and well-being. And that's so important. I'm Dr. Andrew McSwain. This is the Feel Better, Feel Great podcast, episode 160. So just a little disclaimer that this information is for educational purposes only. I'm not your doctor. I might love to be your doctor if you connect with the clinic, Michigan Center for Holistic Medicine, or even better, maybe, is getting started with some of those online courses that I offer. And of course, subscribing, clicking, sharing to this podcast, and so that we can get to know each other better and I can help you feel better and feel great. Okay, so, when you think about how the system is broken for conventional medicine, it's frustrating, right? You might have 15-minute appointments. The visits are rushed. You're told your labs are normal. You get pills without answers. And a lot of times, as a conventional doctor, I was triple booked in a 20-minute time period, which meant I was pushed to see over 30 patients a day. No, I just told the hospital that I could see 23 at the most. And they told me I was weak, and I told them I didn't care, that I could not care for someone with a health problem within a 5 to 7 minute window. It was insane for me as a provider. It was insane for me to think about that towards another human being. And so we look at a system, right? Now people understand that when they go to the doctor, they're only allowed to have one thing they can talk about, right? But that doesn't make sense, because oftentimes if you have a problem, it actually has a lot of symptoms or manifestations. And also, you don't always know what the problem is. So you're going there to work with a diagnostician, right? So, there's a lot of stories when you realize that conventional model was not really built for healing. And if you have any of those stories or you want to chat, put them in the chat. I can tell you it's all the time. It's not your fault that you've been dismissed or even properly diagnosed, because some of these things take thought. Now, think back to the last time you left a conventional doctor's office. How did you feel? Did you feel heard, or did you feel dismissed? And did you feel hopeful or helpless? I remember in medical school, there was a book given to us on the first day called On Doctoring. And it was a series of stories and poems from doctors that had written, so all throughout kind of time, right? Anything from Hippocrates to other, modern poetry. William Carlos is, I think, one. And anyway, one thing that I gained from that wisdom from other doctors was sometimes holding someone's hand matters the most, right? Walking through the journey, but sometimes just holding their hand, like being available as another human being who's a qualified practitioner to support someone. Now, that is just the human connection, the human existence. And we need that from someone who we hope will help us heal. All right. So if we look at the root of the problem and what conventional medicine gets wrong, first of all, this is really important. It's designed for crisis care. I don't know why, but the model of get them in and get them out has to be designed on something that's like singular based, as I said, or that is like, okay, you're in a crisis, let's get you well enough to get out of the hospital or get out of my office. Not that I would say that, but it's not about dealing with something that's complex, like a chronic situation or a chronic condition, or that's preventative. Okay, so it also focuses on the symptoms and not the systems. Now, I want to be a little bit clear about that because when you have symptoms, they do need to be addressed, right? And I do in my practice address symptoms because that's what you feel, right? And you need to feel like symptoms are being addressed, but it can't just be the symptoms, it has to be the systems. That is so important. I remember seeing a young boy in my practice who was very, very ill. And his parents came and they said what was happening with him was a lot of like crisis symptom addressing, like abdominal pain, ER, take medication so he doesn't have abdominal pain, go home. But he doesn't not have a problem with his abdomen. He now has his abdominal pain addressed. Okay, so it's a symptom treatment, but it's not a system treatment. And I see that over and over again. And so if you deal with focusing just on the symptoms, then you're really just looking at kind of that expression that the body has. And oftentimes that comes into some level of discomfort or dysfunction that you can address, but are you addressing it in a way that actually serves the body? Okay, so for example, when people have symptoms like urinary leakage, and then they get a medication that stops the urinary leakage, that actually alters their entire immune system and their neurologic system because that medication is stopping the overurination, but at what cost? Okay, so it not only is a lot of the emphasis to get rid of the symptoms, it's actually then creates more problems, right? Because that's the huge failing of any system, or any operation that is just focused on uh, pushing people through numbers, right? And then there's definitely an over reliance on prescriptions, and that in and of itself is a problem. So, can you heal? Yes. Do you sometimes need support and supplementation to do so? Yes. Do you sometimes need medications? I think they have their place. Very small, very distinct, very succinctly in their use. And I didn't feel that way when I first started in holistic medicine. When I first started in holistic medicine, I was like, no medications. Like I was really kind of dramatic, if you will. I was trying to take a stand, right? I was trying to divide, where was the division between what I had learned in conventional training and what I had to think for myself was the path to help people heal. And so I think I probably went like, okay, no meds, no antibiotics ever. And then you get in situations where you're like, okay, where is a place for that? And I feel like that is a place of wisdom, right? That is in my mind, that is a place of wisdom. And I would say if you're over relying on prescriptions, that is not a place of wisdom. Because first of all, you're just looking at symptoms. Second of all, you often don't understand all the ramifications of that prescription, right? And that is very important. The other thing that is failing our system is it is not patient driven. You are the patient, you are the consumer. And when an insurance model comes in and says, I am the consumer in essence, right? I am the representative consumer. Then what happens is the patient's needs are secondary in the system, right? And I'm only laughing because I'm crying because insurance driven decisions are absolutely debilitating to people's health because they are insurance companies and corporations that are big are motivated by shareholder dividends, profit. And I'm not going to go too far into this, but this is my line. So if you are the consumer of your health care, then you are receiving more. because the person who is serving you is speaking to take care of you and your goals. What are your decisions, right? And how is that being done? So there's a lot of understanding there as who's in charge, right? Are you in charge? So you're in charge, you have control over your health. That's what matters. And that is the fundamental pearl in this, right? That you have to be in charge of your health. And these are the ways that the system is failing us. So, have you ever had a doctor treat one part of your body while ignoring the rest of your body? So that's a little bit of a tangent from what I was saying, but that's the idea, is because a lot of this go here, go there, go there, go there. Oh, you have a bladder? Okay. You go to your primary care doctor, who actually, if they're hospital employed, the way they make money for the hospital is through referrals and through the labs and through the testings that go on within the hospital. They don't actually generate their own revenue. So they have to refer in order to be sustainable for their position. So all of a sudden, you're a bladder and you're a heart and you're a autoimmune problem or you're an endocrine problem. So now you're going to get the individual advice of these four people. And you think, well, those four people have this craft, they have this profession, they know how to deal with this particular specialty topic. Okay, yes and no, because if you take the body out of context, right? If you take anything out of context, think about a car, a bicycle, a house, whatever. If you take it and you just identify that as a singular problem, then you lack the context, right, for that situation. And that I see over and over again happening. It's like, oh, I had a problem, so I had to go over there and they gave me this, but then I realized that was a problem that affected my heart maybe, so then I had to go to the cardiologist, and then and all this. And all of a sudden you have a lot of, the elephant idea, right? So like, where you can't only feel, right? You can only, the person who's doing the examination of the elephant, right? So the old adage is like, if people were blindfolded and then they had to go and touch the elephant, what would they say? Like a rope, a tree stump, so they'd take the information in isolation, assimilate it, process it, and then make assessments and recommendations without any context. So, if you're being treated as one part of your body, I can just tell you that is a failing. Okay. And then this is something that there's a line here that I want to say. What label or diagnosis have you been carrying that doesn't tell your full story? And that is so important. I remember this wonderful patient I had in my practice, and actually, I think she had some horrible infection. She probably had Lyme, now that I look back on it, knowing so much more about Lyme, and really downtrodden, da 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 da. And she had been given a gallbladder diagnosis, right, of cholestasis. And now she's like, oh my gosh, this woman also had autoimmune stuff. I mean, it was horrific what she was contending with. And she's like, I got my diagnosis, cholestasis. And, that really just means slow gallbladder. I mean, who doesn't know that they have a slow gallbladder when they're a female over 40 who's had kids, right? I mean, is it something that, is one part of you? I mean, just think about those ideas that you have something that's a label or a diagnosis that isn't reflective of the whole person. And also, is that diagnosis like very small thing, like a sluggish gallbladder, when actually you have a multiple systems involved, so multiple organ function that are having problems. So what label or diagnosis have you been carrying that doesn't tell your full story? And I hear that every day. You get caught up into this trap, and then you're a good person, you get stuck in the system, you keep going back, hoping this time you'll get answers, but then the tools that they're using aren't designed to find the root cause. And one of those things is you're taking antidepressant for hormone imbalance, right? Oh my gosh. I remember this beautiful patient, and she came into me, I was a resident, and she said, I need to be on antidepressant. I said, why? Like she had, I guess, watched the commercial. Her family had told, she said, my family told me I need an antidepressant because I'm angry. And I said, why are you angry? And she said, people are taking, like my kids are stealing money out of my purse. Some other family members, you know, are taking money out of my purse and, stealing some of my possessions. I said, you are allowed to be angry. You're definitely allowed to be angry. That isn't need to take an antidepressant. That is allowed. Anger is an emotion. You're allowed to have it. And definitely for some people who have hormone imbalances, that can create some emotions, right? So they can even be despondent. They can be, anxious. They can have difficulty in relationships. But taking antidepressant so often numbs people. It does not support hormone balance. So that is really important. Okay, what about taking like different, like you have acid reflux, right? And okay, we'll just take omeprazole or propranozole, or just take something so that you can address your gut issue. But actually one of those reasons is structural, right? Or you're eating food that isn't good for your body and your body's telling you to stop eating that. So maybe you need to use it for a little bit, but you don't need to be using it prolonged because there's a huge consequence to that. So, that's important. And if you're feeling that way and you're not one size fits all, right? This doesn't work for everyone. In fact, that is one of the elements of individualized medicine is what is stuff that's education, right? That's the first foundation. Then what are options? Because people deserve to hear options. And that's another way the system fails us. Because so often when you have a few minutes to tell someone something and you got to boil it down, right? You have to summarize, you have to, say, oh, this will solve it for you. And it's like one thing. And you're like, okay, well, I would imagine there'd be a multifactorial approach to this because there's a multifactorial problem. But nonetheless, 5 minutes, one size fits all. Here you go. This is the problem. And, you have no idea what is going on. And that's very important. So, um, you know, that's, if you feel that way, or you've ever felt that way, please comment in the chat or the DMs, like, yes, I felt that way. Think about what's one time you knew something was wrong in your body, but the test said everything was normal. And I see that all the time. I remember having a patient come into my clinic and she's like, please don't tell me I'm normal. Draw the labs. Please do not tell me I'm normal. And she came into my office and she sat down and I said, there's stuff here. Like there's a lot of abnormal findings. We can fix it. Once you have the understanding of what's going on, you can really get to work. And she started crying. And I said, oh, that's, what's going on? She said, another doctor today told me everything was fine on my labs. And I am so relieved that you have told me that something is wrong, because something is wrong, right? Something is wrong. And if you can smell it, but you can't figure out what it is. And, a lot of people can't figure out what it is because it's very difficult. They have their inner knowing something is wrong, right? But the body is a very complicated machine. And I call it a machine, but I don't mean to oversimplify it. It's a complex milieu of systems, mind, emotion, structure, right? The physicality. And so your inner knowing is sometimes all that needs to be known when you go to a provider that listens. And so, their messages, they shouldn't be dismissed. In fact, awareness is a really critical key in a lot of the courses and the podcast membership, because gaining awareness is a remarkable tool. And it's so difficult in our bodies. So often when people have a problem, especially a really hard problem, they start being told they're fine and they don't believe it, but they have no awareness. They start to lose the awareness, because you have to validate your knowing. You have to believe yourself. And if other people don't believe you and they keep telling you, I don't believe you, right? Like we have a episode coming soon on mold, and people feel like they're crazy with mold, but it's a mold infection. So check that one out if you feel like, man, this is all my energy is just gone. Or, I can't think anymore, brain fog, da da da. We've got to keep getting that awareness going. So stick with me on that one in the podcast, and we're definitely help you build awareness. And one of those things is starting to recognize the signals in your body. And I've seen some people really try to explain things to doctors, but they know something's wrong, but they don't know what it is. And so, we just keep searching, keep searching. And what's one signal your body's been giving you, and and what might it be trying to say to you? So the idea there is, I often tell people, like, you feel pain in the muscles, but maybe the muscles are actually stretching. You're getting a message from your body, but it might not be what you think is the source of the pain or the problem. And I think about a baby, right, that expresses through cry. So if the baby is crying because it needs its diaper changed, or it's crying because it needs milk, or it's crying because it's tired, or it's crying because it's afraid, and all you process is that it needs milk, and then you give it milk. And I have seen parents do this, and I'm sure I was at fault. One time, actually, my daughter, she learned a little bit of sign language as a little kid, and we were at the dinner table. It was maybe like 7 o'clock at night, and she was not communicative. So she was probably like, I don't know how old she was. Maybe she was like 14 months or something. And I said, what's going on, honey? How's it going? Because I thought she didn't like her food, or her stomach was upset or something. And she went like this. She was tired. So she was able to communicate something that I didn't understand the grumblings, right, as a mom. But because she had this other language, she could share with me what she was feeling, and picked her right up, got her ready for bed, and she was out. So she could listen. And if you can develop that awareness, that takes a lot of restructuring sometimes, especially, I have to ask the question, do you trust your body? And why or why not? Right. And do you trust your body kind of, or you're always kind of expecting this system to have a problem? Again, checking in on that awareness so that we can really define what health actually means to you. Okay. And it's, another thing too about what does health actually mean? It means that health is dynamic, right? Health is not like you get healthy and then you're like, okay, I'm healthy, check. That would be work. Probably conventional medicine would work if you did one thing and you got healthy and you're like, I'm healthy. Like you just like wear a t-shirt, I'm healthy. You could put on a hat, like I'm healthy, and check, you'd be set, right? But yeah, we all need maintenance. Health is dynamic. Often health is really about your reserve. So how much can you kind of go forward, and how fast can you recover? What's your bounce back rate, right? That's so important. I had a patient in my practice in his 80s, and he came in and he couldn't do anything. No, I mean, he could not spend 45 minutes on a task without being exhausted. And so we worked together for a few months. I think he came in like January, and then by June he was in for a visit. And I said, how are you doing? He goes, I am just as exhausted as I was the very first day I came in here. I said, oh my goodness, please tell me more. Because first of all, I care, and second of all, it matters. So then he said, well, I spent all week last week fixing the sewer system on my property, and I had to use a backhoe, and something large broke. I had to carry that around and fix it, and I'm just as exhausted. And I said, okay, but you worked like a 40-year-old for a full week. Of course you're exhausted, but you bounced back, right? So he didn't just go from an hour of barely being able to fix the plumbing underneath the sink. He now was doing a huge project that required mental, physical exertion to exhaustion. And he was getting up and doing it day in and day out. So you're going to be tired, but you can bounce back. You can show up fully, right? And you can feel deeply connected to your body and to your world. So that's maybe how we should redefine our health, right? How do you define health now? And a lot of times people view it as lack of illness. And in my practice, that's really important. I say sometimes for people they kind of walk back away from the cliff. Hopefully, I'm talking to you now and you don't feel that you're close to falling off the cliff. If you do feel like you're falling off the cliff, you need to get care. You really need to get care from a functional medicine or integrative medicine physician as soon as possible, right? Because if you're falling off the cliff, it's going to keep getting worse and faster and harder to get up. And if you start then moving away from the cliff, that's moving away or reducing disease. And then you're turning around and that's creating ease. So then we start building this healthy, strong, full of resilience, wake up tomorrow and go and, and you can define your life, right? You have control over your health. You have control over your life. So, how do you do this? One, you need to look at your team. Okay. So building your team is building your tools. Okay. So that's really important. Not so you have 4 or 5 specialists working on one part of you, but you have people who are looking at root cause who can address many different issues. Right. And that's important. You want to talk about, how does my body work? What's going on with my mind? Are you receiving information on nutrition that's applicable to you and provided to you by a qualified practitioner? Everybody eats, but that doesn't mean everyone knows about nutrition. And so are you actually working with someone that can implement nutritional values into you so that you can understand your nutritional well-being? And also the same with mental health. Everyone has, mental capacities, but how much health are you learning from this person? What are you gleaning, about this? And obviously, working with a doctor that can support your team, right? So if you are working with a functional medicine doctor, good for you. That's really important. Or integrative medicine doctor. Holistic doctors are like me. I'm kind of all three of really functional medicine, holistic, but from a very solid background really matters. So who's on your team right now? And that's important. Who's missing? Okay. Can you incorporate a conventional doctor a little bit and understand also like a bigger picture of getting that support that you need? So, because you don't want to, how do I say this? You want to make sure rather that you're really getting in, feeling a sense of well-being, confidence, and that you look at objective markers to get better. Okay. If you're in a situation where you're just getting sicker or you're being told to do the same thing and you don't understand why, you don't value it, or you don't feel that it's right, you need to convey that in a healthy environment to your practitioner so you can get better. Okay. And so if you've been failed by conventional medicine, I want you to know the story isn't over. Okay. And here is the plot twist, right? Start gaining the power within yourself so that you listen and you believe yourself. I have to tell my patients when they come in so often, I have to say, I believe you, right? If you're coming in carrying 2 boxes worth of records because you want me to believe you, I already believe you. But make sure, please, that you are working with a provider that believes you. Okay, that's first and foremost. Then working with someone that really is starting to look at, how you can move forward in your health, right? Not just addressing an immediate need, but actually moving forward with a dynamic sense of health. Okay, so I was hoping today that you could, write down, either DM or tag, that you could write what's one thing you're taking back starting today, right? And that sounds a little vague, but basically, like, I'm taking back my sleep. I'm taking back that I believe that I can get better, right? I'm taking back that how I feel matters, not just to me, but to my healthcare provider, right? I'm taking back the fact that if I feel anxious, there's a reason. If I feel anxious, there's a reason. And it's not just because, okay? There's a reason. It needs to be supported. And so these are the things I want you to think about you're taking back starting today. And lastly, what would it look like if you stopped outsourcing your health and started trusting your body again? So if you're outsourcing your health, you're losing control, right? You're giving someone else the responsibility. And, I tell my patients in the practice who come to me and they're like, I'll do whatever you say. I said, well, that doesn't work here. No way. Because I believe in your autonomy. And my job is to give you education, options, and recommendations. And my job is to respect your decisions and to help you continue to move forward with your health. So I don't allow anyone to outsource their health to me. I don't allow them to put it on me, right? I provide information. I definitely give education, options, recommendations, and respect because it is your body. So, how are you really taking control? And if you're going to the doctor and you're getting the same information, it's going to be very difficult to get a different result. But if you start looking at who's available to you, I will tell you, there are a lot of doctors like me who took a path that we, in our soul, knew why we wanted to be a doctor, which is to have a way to help people heal themselves. One of my favorite books, and the book that changed me, it made me decide to be a doctor, work as a physician, is called The Physician Within You by Dr. Gladys McGarey. And when I read the book and I heard the stories, I read the stories of the patients in that book, I knew that my job was to help them to help themselves to heal. The physician within you, that is what you have. So if you're looking outside to be validated and be believed, that's okay. But you have to also know in your heart that you deserve to believe what you believe, and you deserve to have what's going on in your body be shared and recognized so that you can heal. Okay, the physician within you. Thank you so much. And I look forward to seeing you. If you would like to like, click, subscribe so you know in this channel when I'm going live again. I'm working on going live a few times a month. We're changing up our platform. We have lots of guides for you so we can help you get better. And stay tuned for more. Have a beautiful day. And I am just going to thank you.